Hi, everyone. I'm Dr. Michelle Hure. I am a clinical dermatopathologist and owner of Orange County Skin Lab here in San Juan Capistrano, California. And I want to talk to you today about forever chemicals and how they relate to us on a daily basis in dermatology. Let's sort of get into it because I know that maybe people have heard this term in the media, forever chemicals, and maybe you're not sure exactly what that could mean for you on a daily basis, either in your life or in the exam room. I have no relevant disclosures. So always start off with a case. And this is the case that kind of got me really interested into this topic. And, is this something that we should be looking into a little bit more? So starting out with a 47-year-old female firefighter with, absolutely no other issues. She's totally healthy. She complains of a several-year history of these, what she calls chapped lesions in her vulva. It's painful, it's erythematous, maybe it's also a little itchy. It's just very uncomfortable. And it happened after every single one of her shifts. And, she had some resolution when she was off at home, whether it was a week off or 2 weeks off, regardless of whether or not she was treated. And she had been treated by multiple other doctors with different things, antifungals, steroids, and nothing really either helped keep it away or helped prevent it. And really, this caused her considerable issues, mental health issues, because even though she loved her job and she loved going to work, this was an issue because she knew for the next, week or so after her shift, she would not even be able to sit well. It would be very uncomfortable. Maybe wearing underwear was going to be an issue. And it was just causing her a lot of trauma and even considering going on disability for it. And this is what it looked like when she came to see me. And this was a few days off of her shift, so it wasn't as kind of, bright red as it usually was, but it was definitely there. And she has definitely pain here, even though it doesn't look like all that much. And it kind of moved here and there. It wasn't always in the same spot, but this was pretty much it. And it was kind of like, okay, well, let's biopsy it and see what happens because she had never had a biopsy in the past. Now, I know, no, not a lot of you have looked at slides, and that's okay. Let's kind of go through it briefly. So this was the biopsy that I took. This is the very top layer of skin. That's the stratum corneum, and it should have no nuclei in it. So these are cornified cells that get kind of shed off into the environment as dust, and they should be anucleate. And these have nuclei. So that is parakeratosis. So that sort of speaks to the chronicity of the problem, that it's been around for a while. This is the epidermis, and the epidermis here, you can actually see the bridging between the squamous cells. So when you can see kind of all of the connections between the squamous cells, and it's almost like these fingers interdigitating, those are the connections. And if you can see that, you know that there's some swelling, there's fluid there kind of pulling the cells apart. It should normally kind of look like this, where they're tight together. And so if they're getting pulled apart, that is swelling, that's spongiosis. And there's an inflammatory process that's causing edema in between the squamous cells. So a dermatitis. And you have these little dark cells here and there. These are lymph cells. These are white blood cells. These are, there's some plasma cells. This is a chronic issue here, and there are no eosinophils that I could see. So I'm not quite as worried for an allergic contact dermatitis or a drug reaction or anything like that. And there were no signs of anything like lichen simplex, lichenoid sclerosis. There are no viral changes. So, in the end, I ended up calling this an atopic dermatitis or maybe contact. And so I called the patient. I said, let's talk about this a little bit more. Please. So after every shift you get it, what are you doing? What are you wearing? And she basically said that no matter what, whether she went on a call or not, she would have an issue. And it really started about 6 years ago when she started wearing something called Nomex pants. And Nomex pants are what you wear on a daily basis. That's kind of your uniform around the station, whether you are on a call or not. That's just what you wear. And Nomex pants are meant to, kind of make sure you're not getting any of the bad chemicals in the environment on you. They're trying to be protective against all the hazardous things that you can come into contact with when you're at work. Okay. In addition, she also got a new pair of turnout gear. And turnout gear is, this is what you see most firefighters wearing when they fight fires. And it's supposed to keep all the bad things on the outside and keep you protected on the inside, whether it's from heat, from water, from hazardous chemicals, oils, that sort of thing. And just to kind of bring it home to me, this was me 1,000 years ago when I was also in the field as a medic, wearing the same type of pants. Okay, so a lot of people have the notion that firefighters get issues with chemical exposure when they have when they're out on a call and they get a call where they have are taking care of a fire and they're getting the chemicals that are combusted in the fire on them. When in reality, most of the chemical exposures that firefighters have are to the things that they're using to actually fight the fires. So that's their gear, as well as the film that they use, the foam, to fight the fires. So let's talk about the gear. So the gear is meant, obviously, to keep everything bad out and keep all the good stuff in. Well, unfortunately, in order to do that, the gear itself has to be pretty impregnated and made up of chemicals to do that, right? So they have to be water repellent, and they have to repel oil and grease. And if anyone has ever worn these things, you know that you tremendously sweat. And when you have water on the surface of the skin, you know that you will absorb things better, okay? So some of the things that are found within this gear: brominated flame retardant. Okay, so there have been a lot of studies on this. This is actually another type of forever chemical. It's persistent. It definitely accumulates within your body and is directly toxic. So the other thing that this gear has is benzene. And I'm sure you've heard of benzene. This is directly carcinogenic, okay? And this is something that you really don't want to have contact with on a daily basis. Now, a little bit here and there, not a big deal. But to the extent that these firefighters are having exposure to it, probably not a great thing. And this was actually a very interesting study that looked at kind of how these firefighters are getting exposed to all the different chemicals. Namely, let's talk about benzene. So just briefly, they took these firefighters and they put them, whether it was brand new gear or laundered gear, they kind of covered them all up, make sure everything was tight. There's no way anything from the outside is coming in. And they also put them in their self-contained breathing apparatus, so kind of their own oxygen supply. And then they kind of bombarded them with chemicals that they would have they would get exposed to in a fire or not. Like they didn't expose them to any chemicals. And then they kind of measured how much benzene they were exhaling. And interestingly enough, whether they had, brand new gear or laundered gear, or they were exposed to outside chemicals or not, they had increased levels of benzene that they were exhaling. And they felt that this was directly related to the gear itself and that it was being dermally absorbed. The other thing that is found within this turnout gear, and it's actually 30% by weight of the gear, are per and polyfluoroalkyl substances, or the forever chemicals, which is a really big deal. This is the other thing that firefighters get exposed to often when they deal with fuel fires, is the AFFF, or aqueous film forming foam. And this is almost all PFAs, or PFAS, the forever chemicals, because of the levels that the firefighters have. Here in Southern California, we have a biomonitoring program that was initiated by UC Irvine with a couple of different governmental agencies, and it actually tests firefighter blood, and they actually have to get tested every year for forever chemicals. I actually have a patient that is part of this program, and their levels tend to be ridiculously elevated over the population, and they follow them for all the diseases that they get. And a couple or three papers that they have come out with basically have shown tremendously elevated levels of everything from BPA to BPE to benzophenone 3, and of course, the PFAS and even mercury. So this is a big deal. And why? Because we all know firefighters get a ton more cancers than the general population. And they're about 10% more likely to get cancer and 15% more likely to die of cancer. Of course, for us, we care about the skin cancer risk. You know that you have to monitor your firefighter patients as well as your pilots a little bit closer for skin cancer. And unfortunately, in these sort of studies, women firefighters were not all that well represented, but there was a very interesting paper that was published where they looked at female firefighters in San Francisco, which there actually tends to be a high percentage than the general firefighter population in the country. And they looked at whether the women who were actually on active duty, going out on calls, or the women that say were working in the office, they were wearing the same gear, the same Nomex pants, and they found that whether they went on calls or they stayed in, they actually had very similar blood levels, serum levels of PFAS, and that this cohort of women actually had a 6-time higher risk of getting breast cancer than the general population as well. So this was a big, big deal. Let's talk a little bit more in depth about what these chemicals are, the per and polyfluoroalkyl substances. And that actually includes something called PFAAs, so polyfluoroalkyl acids, as well as precursor agents that get turned into the PFAAs with biotransformation, whether it's pH, heat, sunlight, whatever it is, that it can actually change into one of the PFAAs. And if you want to think about anything that you come into contact with on a daily basis as to whether or not it could have a PFAS in it or a forever chemical, you'd probably be right. So in the 1940s, this was manufactured by 3M. And it was meant to resist water and oil and stains. And you know this as Scotchgard and Teflon. Okay, these were the initial original ones, which were the PFOA and the PFOS. And, you know, that was wonderful. They worked great because they are chemically and thermally stable. They also are highly mobile. And this is important in the water supply because it just kind of goes everywhere. And it's very, very unique in the properties that it has, which actually not other chemicals have these sort of both hydrophobic and lipophobic properties. Usually you have one or the other, but the fact that it has both is kind of what makes it a great thing of kind of balling up and resisting things like the water and the oil and grease. And so to date, we have over 9,000 of these PFAS compounds. Most of them are those sort of precursors that turn into the acids, but there's over 9,000. It's really, really crazy. And they have absolutely been linked to various diseases, especially the developmental abnormalities and cancers. The most important thing is the fact that they are persistent in nature, and these are why it's called forever chemicals. They don't break down with normal processes like heat and UV exposure, and they absolutely bioaccumulate within our bodies, within wildlife, within the food supply. So this is why it's so insidious. And this is what it looks like. It can be up to 6, 8 carbons more chain with a fluoride on top, and it is very strong. So here are some of the different ones, the most common ones that we find that are kind of talked about: PFOS, PFOA, a ton of different ones here. And this is really important. Look at that half-life. Look at the half-life of these guys. So 8 years, 5 years, this is within our body before it kind of passes through into the environment. And take a look at this in more detail when you have a chance. But, forever chemicals, the PFAS, which are mostly through, you mostly get exposed through inhalation and ingestion, right? So breathing the air, drinking the water, eating the food. And it has a whole list of things that it can affect, and not just, cancer, but a ton of different things in men and women and babies. The up to date, though, most people thought it was just inhalation and ingestion, when really the dermal contact, the exposure we get, and the absorption through the skin actually may be a very significant thing, and that not a lot of papers have looked at. So this, I want you to keep in mind, in addition to things that we talked about prior with the issues with the firefighters and their risks for skin cancer and other diseases, just because of their occupational exposure. So for us in general population, so we're not all firefighters, how are some of the ways that we are exposed to PFAS? Well, obviously drinking water is a big one. Food that we eat, even the air that we breathe, especially if we're near places that are producing these things, right? And so let's look at the water. So I am never really a fan of the EWG. I believe that they have an agenda, and there are a lot of fear mongering. But in this situation, I think they did a good thing where they went around the country and they tested PFAS levels in the water. And at the time that this was published, the EPA only had a 70 part per trillion limit on their PFOA and PFOS levels. They have since decreased them to 4. And so that's great, except who knows if that's ever going to really happen. But you can tell, kind of depending on where you live, you may have higher levels or lower levels in your water supply. But for this for this talk, I really want to talk about the issues that you see in consumer goods. So what we're buying, using on a daily basis. This is really important for us in the exam room, right? This is the what do we care? Well, what we care, this is important. This is going to affect how we treat patients and how we manage them. So there's not a lot of papers talking about the role of PFAS in dermatology, and that is because there's not a lot of data as of yet. But looking at the data out there, then I really feel that we should be looking at their role in atopic dermatitis, in endocrine disruption, because we do have papers talking about the risk of diabetes, thyroid disorder, sex hormone disorder, whether it's menarche issues, menopause issues. And then we have issues, obviously, we know about with skin cancer, there can be a link. And then another one is decreased vaccine efficacy, which is actually very interesting to me. So we're going to look at that too. You've all seen these things in the media. And I actually, when this first sort of hit, and this was after a big study came out, which I'll go after, there were a lot of big dermatology accounts on social media that were really downplaying the role of forever chemicals and PFAS. And they kind of likened it to, oh, it's a new paraben. The problem with that is that, yeah, it's not a new paraben. It actually is way more insidious and detrimental than the parabens are. And I do think parabens have been kind of demonized. I think there are some bad ones. But this is a whole other beast to deal with. And I really feel that we shouldn't just sort of play it off as nothing, and we should look at it a little bit closer. Very briefly, I want to talk about mechanism of action. This is kind of one of the main reasons why this is such a problem, is because these compounds actually kind of mimic fatty acids. And you can see it's very similar in the way that the compound looks, except instead of a carbon hydrogen, we have a carbon fluorine. But really, they're very similar, and they can act very similarly as well. So this is kind of the whole map of what it can affect. Now, I want to please keep this in mind. The exact mechanism is not known. These are kind of like here and there because I feel that it affects a lot of different things. There's not one pathway of how it affects us. So it's kind of all over the place in what it does. So let's look at this. So for the sake of this talk, I'm not going to discuss the kind of atopic march that has been found with PFAS exposure, but definitely there has been issues with asthma as well. And this is due to the high IgE that they found in these patients with elevated levels in serum. It also has more of a mast cell activation through the induction of inflammatory cytokines and a transcription factor, NF-kappa B. So in addition, PFAS will, through cytokines, affect the Th pathway. So maybe you have less of a Th2 response, which means that your B cell antibodies might be decreased, and you have more of a Th1 response, which this may be an issue with, like, say, atopic dermatitis, I'll talk about later. Directly, PFAS will decrease the IgM, T cell dependent antibody response, which is the issue with the vaccine efficacy. And through actual change of the receptor of PPAR alpha expression, that's how we get our issues with our metabolic and endocrine dysfunction, as well as tumorigenesis. And interestingly enough, actual epigenetic changes on cells themselves, whether it's DNA methylation, histone modification, microRNA expression, that can change the gene expression and then lead to issues downstream. So it's very interesting how it affects everything. And for us, let's talk about it. This is, if you read one paper, read this one. This is the one that kind of broke open everything. So they looked at about 230 different cosmetics out in wherever, Sephora, Target, whatever. And they looked at a proxy and they checked the fluorine levels, which kind of tell us a little bit as to how much of the fluorinated compound is in it. They found that half of these had fluorine, okay? So they took those and they realized that they needed to be tested further, right? So they took these 52% and they randomly took 29 of those products to check more of a targeted analysis, like looking at individual PFAS, so whether it's PFOA, PFOS, and because it can be a little bit expensive to look at all 230 of them. Interestingly enough, of the 52% of the products that had increased fluorine levels, only 8% of those had something listed on the ingredient list. And of the 29 products that they targeted, only 3% of those had any sort of PFAS listed on the ingredient list. This was huge in that when they tested all these guys, they ranged, the PFAS concentration ranged from 22 nanograms per gram up to 10,500 nanogram per gram. The average for each one was over 1,000 nanograms per gram. Please keep in mind, the EPA safe level now is 0.004 nanogram per gram. This is huge, especially when you consider the fact that you can absolutely have issues with dermal absorption, which we've seen in the firefighters, but this is more of a direct path, right? So if you put something on your eyes, it's going to go in your tear duct. It's going to go, you're going to inhale it if it's a spray or anything close to your nose, and you're going to eat it if it is a lip product. And by the way, the lip products had the most sort of number of PFAS, and most of the products, the lip products, had PFAS. They may not have been the highest. I think the 10,500 was long-wearing foundation, but definitely the lip products had, most of them had something in it, okay? And that makes sense, right? So let's talk about that dermal absorption. If it doesn't have a direct effect by going in the mouth or the eyes, what about the dermal absorption? There aren't a lot of studies on this. this was a great review article kind of looking over all the different pathways of PFAS exposure and specifically dermal absorption. And they really list one study. And unfortunately, it was in 2012, but that was maybe when it was a bit more ethically acceptable to test on animals. In this study, where they looked at a segment, they had skin, right? They want to look to see if a test compound got through the epidermis and down the dermis and would have gone into the blood supply. And so they used in vitro studies on mice where they actually put the sample on top and then they measured the serum concentration in the mice. And then they took full thickness and did in vitro testing, full thickness of mouse skin, as well as full thickness of partial, so epidermis and dermis, and full thickness skin, where they actually kind of looked all the way down here to see if the product penetrated through. And they used human skin that was cut out from cosmetic surgery. And they found that the mice absolutely had elevated serum levels of PFOA when they had increasing concentrations put on the skin. And the same thing for the in vitro testing, both on the mouse and the human skin. And they found that the absorption rate, the total rate actually, where a compound put on the surface of the skin made it either into the epidermis dermis and stayed there, or actually would have transferred all the way through into the blood supply was 69%. The amount of PFAS that was applied to the surface that actually just went straight through and didn't stay in the skin was 48%. So that is a huge percentage of chemical, so PFOA, PFOS, whatever the PFAS chemical is, getting into the intact skin. Why is this important to us? Let's look at PFAS and atopic dermatitis. Is there a risk for it? And it absolutely is a possibility. There are a couple of studies. They looked at, this is prenatal, so we're looking at kids here. There are no studies in adults. And they follow these mom-newborn pairs where they have serum levels prenatal, as well as following them through for a couple of years, and whether it is going to sort of correlate with increased risk of atopic dermatitis. And it absolutely did. The interesting thing, which I am not sure why, but it was only in female children in this study. The male children did not have a correlation. This study also looked at the same thing where they checked the serum level, and this was a 4-year study. And they found that it also had an increased risk of atopic derm, but only if they had a second hit, if they had a GSTT1 issue, gene issue. And that gene will affect detoxification and clearance of reactive oxygen species. So there may be something where you have to have a genetic predisposition, and then the PFAS will cause atopic derm. We already know endocrine disruption is a thing, and PFAS concentrations absolutely corresponded to increased FSH and decreased estradiol levels in pre and peri and postmenopausal women. And that really showed them, and it affects reproductive aging, menopause, ovarian dysfunction. And then what about PFAS in younger patients that maybe have an increased risk of PCOS? And absolutely, unfortunately, this was a retrospective study, but it did correlate with PFAS exposure increasing the risk, the hazard ratio for developing PCOS. The same is found in thyroid issues. And this one looked at the kind of the older PFAS and the newer PFAS. So the older ones were longer carbon chains, the new ones are shorter carbon chains, because 3M thought it would be safer. And in reality, the short chains are actually more detrimental. And this study found whether it was the old or the new, the thyroid dysfunction was there. It was directly cytotoxic. It accumulates within the thyroid. It can actually change the weight of the thyroid. It interferes with hormone synthesis, thyroid peroxidase function, and iodine uptake. Unfortunately, in a lot of these cases, that had hypothyroidism, sometimes the TSH was normal. So maybe you might have to check more than just the TSH on your patients who might have thyroid issues. Vaccines, absolutely. This is a great study in JAMA that looked at serum PFOA and PFOS levels in kids, and they found the higher the level in the serum, the lower the antibody response was for the typical childhood vaccines, with everything else controlled for. And in this study as well, same thing. When you have increased PFOA concentration, your antibody response goes down. Okay, so this will definitely be an issue for long-term protection for patients that are getting vaccinated. So for us, our significance, we really need to consider exposure and things obviously like skin cancer, that's a given, but maybe atopic dermatitis, acne, our PCOS patients, menopausal dermatologic changes that we see. And I think menopausal medicine is definitely neglected in most of fields of medicine, and potentially dermatology as well. Thyroid dysfunction, so our hair loss patients, our treatment-resistant acne patients, dry skin, and then all of our psoriasis patients who maybe are on immunomodulators or suppressive agents, maybe their vaccines won't be working very well if they're having a high PFAS concentration. These are some buzzwords to consider. Please kind of read through this. So most of the time, if you see wear resistant, water resistant, smudge proof, all this glass skin, be very careful. Even if they don't list it on the ingredient list, more than likely it will have some PFAS in it. Going forward, yes, absolutely. There are potential for regulations on this, whether from the EPA trying to decrease the levels allowed in water, even though they're only really doing that for 6 out of the 9,000. At least it's a start. The FDA is trying to do something by updating its MACRA, Modernization of Cosmetics Regulation Act, looking at how do we kind of enforce these product manufacturers to either list their ingredients, let us know if there are any issues with safety, and they're really trying to kind of make it more of a regulated environment for these the cosmeceutical companies to really list their ingredients and whether or not there are adverse health issues with their ingredients. And that hopefully will be something that will help out. And of course, there's some issues, some bills coming out here and there. The No PFAS in Cosmetics Act that was introduced at the federal level, I think is a little bit died, but who knows? But many states have passed their own bills, which has been very helpful. If you want to look into this more, Silent Spring Institute is really great. Look into that organization. It's actually a joint effort between Northeastern and Michigan State, and they're fantastic scientists that are really looking at this. And they helped create this app, which you can have on your phone, called Clearia, it's really, really cool. I have it on mine. So if you want to look for waterproof mascara, say at Amazon, you put in waterproof mascara and you search, and say you want to click on this brand. When you do that, this little guy shows up. And if you click on it, if the product has its ingredients listed, which many don't, it will actually kind of tell you all of the issues with the ingredients in this product. And it'll tell you this is a PFAS. And so maybe you might not want to get it. If you need to check any of your patients for laboratory testing, this is the code. This is through Quest. That's the only one that I have found that actually has testing, the CPT code, the ICD-10. Just realize insurance may not cover. Okay, so how does this relate to our patient? After doing all of this research, and I really feel like I can do a PhD in this topic now, I decided, let's try and change what you're wearing. I really feel that it's coming from your gear. So the patient petitioned to change her station gear, get rid of the Nomex pants. She started wearing actually merino wool, which has been found to be comparable to the Nomex and how it protects you. She also modified her turnout gear to wear something underneath it that's more of a kind of like blocking whatever is coming through. And all of her symptoms have resolved. She's had no recurrence since. And she considers this to be life-changing because now she can go to work and she, can love what she's doing, and her mental health is so much better. So thank you so much for slogging through this with me, PFAS. This is from Fast Times at Ridgemont High, Learn It, Know It, Live It. I'm so happy that you kind of joined me on this journey, and hopefully you're a bit more knowledgeable about forever chemicals. Thank you so much.